Good morning, doctor.
Hello, good morning. So, I have seen all your reports. It seems that oral tablets alone cannot control your blood sugar level. I think it is time to add insulin to your therapy for better control. Now, what is your opinion?
Okay, doctor. Is it necessary?
Yes, oral tablets alone are not at all working in your body, and you have also started to develop diabetic comorbidities. So, it is necessary that you begin insulin as soon as possible. And I suggest insulin pen for your ease of use.
I understand, doctor, but I don't know what an insulin pen is.
You don't need to worry. We have a clinical pharmacist right next to my cabin. He will definitely help you.
Clinical pharmacist? Who are them? Does they have the necessary knowledge?
Yes, definitely. Clinical pharmacists are practicing pharmacists who provide and monitor pharmacotherapy either independently or in collaboration with physicians. They are considered to be the experts in pharmacology. They establish relationships with patients to ensure the appropriateness of medication therapy and to ensure the patient's understanding. They also monitor their effects. They are the right person to all your medication related doubts.
Okay, thank you, doctor. Let me see the clinical pharmacist. Hello, sir. Good morning.
Hello, good morning. How can I help you?
I am a diabetic patient. My physician had advised me to take insulin, as an oral tablet alone are not working for me. He had suggested insulin pen for me, but I don't know how to use it and haven't seen an insulin pen before. Can you help me with that?
Yes, absolutely. You have come to right place. I can explain all your drugs and devices related queries.
Okay. Can you tell me what an insulin pen is?
An insulin pen is a device that makes insulin injection easier and more convenient compared to a syringe. There are a lot of insulin pens out there. Most pen comes with filled insulin and are disposable. When insulin runs out, you can throw that away. Some pens are reusable and come with the insulin cartridge, which is loaded into pen before using it.
Okay. So, can you tell me how can I administer this?
Sure, there are several steps. I will explain each step. Firstly, begin by washing your hands. Secondly, prepare insulin pen. Insulin pen require refrigeration once only before their first use. After its initial use, simply keep your insulin pen out of direct sunlight and in a room temperature settings up to 30 degrees Celsius. If the insulin in the pen is cloudy, you will need to mix it. To mix the pen, first remove caps, then hold the pen between your palms and roll it back and forth about 10 times. Then gently tilt the pen upside down and reverse until the insulin is clear and smooth. You will need to do this about 10 times. Thirdly, remove paper tap and needle covers. Alright, then you need to attach pen needle to the end of pen. The pen needle comes in different sizes, so talk your healthcare provider to choose the pen needle that is best for you. Most insulin pen needle come with two caps, so first take off the outer cap and hold on to it. You will need it when you are done. Then take off the inner cap covering needle and throw it away. Fourthly, prime the insulin pen. Priming means removing air bubbles from the needle and ensure that the needle is open and working. The pen must be primed before each injection. To prime the insulin, set the pen to give a very small amount of insulin, for example 2 units. Do not inject these, instead point the needle up, tap the pen gently and squirt the 2 units into the air. At least one drop of insulin should appear. You may need to repeat this step until a drop appears. Once you know the pen works, set the amount of insulin you need to inject. Fifthly, choose injection site. Find a good spot to inject at least 1 inch from your belly button and 1 inch from your last injection. Injection below the skin of abdomen results in faster absorption than other injection site. Recommended injection site include abdomen, front and side of thigh, upper and outer arms, and buttocks. Do not inject near joints, the groin area, navel, and scar tissue. Finally, injecting insulin. If you want, clean the spot and let it dry. Then gently pinch up skin with your free hand. Insert the needle with a quick motion into the skin. Press the button on the end of pen to push the insulin in. Remember to hold the pen at the side for 5 to 10 seconds. Then pull needle out. If you bleed, put a light pressure on the spot until it stops. Do not rub the spot. Put the outer cap back on the needle and twist to unscrew the needle from pen. Then put needle to sharps container. You should use a new needle every time you inject. Your insulin pen should not be shared even if you change the needle.
Okay, but I am very concerned with side effect of this. Can you enlighten me with the problem of using this pen?
You don't need to worry. There are no major problems for using insulin pen, but make sure you rotate or switch your injection site. If you use the same injection site over and over again, you may develop hardened area under your skin. You can avoid this by rotating injection site. Also, it will make your injection easier, safer, and more comfortable.
Thank you so much, sir. I am very happy and grateful to you for sharing this valuable information. Now I knew how resourceful and helpful a clinical pharmacist is for a patient, hospital, and ultimately to society.
You are welcome. Have a good day.